I'm Dr. Nicholson, and welcome to our video on office-based hand surgery. Doing hand procedures in the office setting has changed the game in hand surgery. Some of the least pleasant aspects of hand surgery in the operating room have nothing to do with the procedure itself. Things like arriving 2 hours early, fasting the night before surgery, taking off all of your clothes, getting an IV, being put to sleep, all for a 5 to 10 minute procedure, make the process unenjoyable. Turns out, doing simple procedures like carpal tunnel release, trigger finger release, and small mass excisions in the office is a much more pleasant way of taking care of you. Now, let's show you why.
I couldn't wait for the pain anymore. I just wanted to get it done.
It's outright pain. It's usually worse in the morning. It starts out like a cramp. It just gets more and more and more intense. And then the pain radiates.
It's tingling. It's like hundreds and thousands of needles at the fingertips all the time.
I think doing it in the office, there's fewer moving parts. Patients just love not having to feel groggy for the rest of the day.
Hello.
On the day of the procedure, you come in and you're greeted by Joanne.
I like to come in just being bubbly and try to make them feel as comfortable as possible.
So I'm going to show you what the incision will look like.
We are doing a right carpal tunnel release today.
Right side carpal tunnel, is that correct?
That's right.
Perfect. No pun intended. So first we made the mark just to show you what we're going to be doing today, where the incision will be. Remember, it's going to be right in the wrist here. Count of 3. So there's 2 components to injections that we do for carpal tunnel release. Count of 3 here, I got a quick poke here, bee sting, 1, 2, 3. Doing okay? There's the lidocaine, which is the numbing component of the medication, and then there's epinephrine. And epinephrine is a vasoconstrictor, meaning it constricts blood vessels so that there's no bleeding in the field while we're performing the procedure. The injection takes about 5 minutes. We do that in the office, and then we wait for about 20 minutes while the injection is settling in. And during that time, we're getting the room ready to do the procedure.
Just in case. Thank you. Shouldn't need it, just in case.
It's normal for patients to feel a little bit nervous before a procedure, especially knowing that they're going to be awake for it. And what we see is that they convert that nervous energy into enjoyment. And we see it during the procedure.
I'm listening to my ABBA song.
To an ABBA song? All right, well, turn it up. I want to hear.
Dancing Queen right now.
Yeah, Dancing Queen. I myself didn't start doing this until I saw the data that showed that infection rates were just as low, if not lower, than when these procedures are done in the operating room. If you look right here, this is your nerve right here. This is the ligament that was compressing it, that we've now released completely.
Where were you all my life?
They see what's been bugging them, and they see what we've done to release it, and that makes them an active participant in their care, an active participant in their recovery. And I find that they recover faster because of that.
Thank you very much, Doctor.
We'll see you in 2 weeks. I think it's something that's really a game changer, and over time I think what we'll see is that more and more surgeons adopt it and more patients come in asking for it.
So that's cool.
So that's the future of hand surgery, and it's now.
Thank you. I'm glad.
We hope you've enjoyed watching this video, and on behalf of our team, we look forward to taking care of you.